All right, so now we're going over another hip test. We're testing hip external rotation with a figure 4 test, or what we call in the PT world a Faber test. Jeremy's gonna cross one foot over the other leg, so he's making kind of this figure 4 position. And then how low can he drop that knee towards the floor without that left side of the pelvis coming off the ground, okay? He should be able to get fist plus thumb from the floor. If you do this test and you can't get all the way there, you got a big gap here, we have a mobility deficit we need to work on. Again, make sure you test both sides. Okay guys, if you failed the hip figure 4 test on the floor, this is one of our favorite exercises to help start improving that motion right away. Jeremy's going to demonstrate here. So we're going to be in what we call a half kneeling position. If we are working on that right hip, we failed on the right side, that leg is going to be up. Then he's going to sweep it out to the side and to open up the hip as much as he is able to, okay? And then what he's going to do is going to grab this kettlebell and he's going to keep it nice and close and tight to him here, okay? Before he goes to lunge that direction, I'm going to have him squeeze or tighten his butt cheek as hard as he can, and then he's going to lunge that knee out over the toe until he starts to feel a good stretch, and you'll feel it. Maybe a second or two, hold, back it off, and then repeat. Make sure each time you're really engaging or squeezing that glute on that same side. That's going to really help us open up that hip joint. And you should feel either a stretch kind of in the groin area. Some of you may feel it over here on this side, but the goal is to how much can I get that right hip to open up with a little bit of load. My suggestion is 8 to 10 reps, retest. If it's improving but not all the way there, you can do another round of 8 to 10 reps.